Hello, my name is Natalie Norton, and I am here to talk to you today about requiring immunizations for all school-age children. I currently am an ICU nurse. However, I have a huge interest in immunization requirements for all children, as immunization status can have a huge effect on all individuals of all age groups worldwide. As a nurse, my role in promoting this policy would be from the viewpoint of public health and the health of all children here in the United States. Mandatory immunizations for school-age children are critical to ensure the health and well-being of all individuals worldwide. Studies have time and time again proven the safety and efficacy of immunizations. However, many families are choosing not to immunize their children due to personal and philosophical beliefs. Here in the United States, each state has the ability to regulate vaccination requirements and exemptions. By developing a nationwide law that ensures all children receive their immunizations, immunization levels in all regions of the United States will be at the level needed to meet the threshold for herd immunity. An excellent example of what can happen if children are not being immunized can be seen in California in January of 2014. An individual visited a Disneyland in California and was unvaccinated and caused a large measles outbreak. And this ended up causing quite a many people. I think it was a little bit over 300 people were infected with the disease. And one of the main issues there was many of the school districts in Orange County have childhood vaccination rates in the 70% range. So these children were not meeting what was needed for herd immunity, and there was a large outbreak. For this policy, there were two major ideas that were considered. One was the idea of implementing a measure to provide all immunizations in school for children. And the other was to develop a nationwide policy to ensure all states have the same requirements and exemptions for vaccination. Each proposed policy was evaluated looking at potential ethical issues, economic impacts, political considerations, social effects, any legal ramifications, and what the ultimate outcomes of these policies would be. After a thorough analysis of it was determined that the policy to go forward with was developing nationwide requirements and exemptions. The reason this was chosen is that eliminating certain exemptions, all of those except for medical, and requiring all states to have the same vaccination standards, the number of children immunized would increase, thus providing higher protection from communicable diseases. The anticipated outcome from this policy is that more children will be immunized to help ensure all children are protected from the vaccine-preventable diseases. As with any policy, there are multiple economic factors that need to be taken into consideration. Establishing a nationwide immunization policy will require financing at the national, state, and local levels. At the national level, the government will need to help fund the states to help disperse the immunizations to local health departments, clinics, and providers' office. States will need to provide funding to help establish extensive education programs for parents who were previously claiming exemption for immunizations. And at the local level, the health departments, clinics, and provider practices will need to educate staff members on the new laws and develop individuals who will educate families of those wishing to claim exemptions other than medical. Some of the economic impacts that you can also see is in one study, it showed that the direct and societal cost of childhood immunizations in the United States are $6.7 billion and $7.5 billion respectively. After evaluating the cost of immunizations in the United States compared to what the savings would be of an outbreak by administering vaccinations, the United States is able to save $20.3 billion and $76.4 billion respectively. So this has a huge economic impact, ensuring that everyone is vaccinated. So it is my call to you to help work towards establishing a policy that will ensure all children in the United States get immunized. Immunizations have been proven time and time again to save lives against these deadly diseases. Many individuals today are choosing not to vaccinate their children for a number of reasons, and if this trend continues to rise, the United States may see more and more outbreaks of these vaccine preventable diseases. By developing this nationwide policy that makes all requirements the same nationwide and eliminates all forms of exemptions except for those medical, providing education to all parents who were previously claiming these exemptions, we can hopefully achieve herd immunity in all counties here in the United States. And the hope will be that we eradicate these deadly diseases here and nationwide. Thank you so much for taking the time to listen to my call today, and I hope you all have a great day.